Kowal. I'm a registered nurse and a licensed massage therapist. I'm going to demonstrate today here at Oakworks in New Freedom, Pennsylvania, and using the Pro Deluxe convertible table, a technique that can be used during the session or to teach your client how to self-care or for your own self-care. This is part of Pillossage, which is thermal connective tissue release, and you can find more about that on Pillosage.com. So today I'm going to do a little self-care for Lisa Severn here, who is from Oakworks, and she is feeling willing to let me work on her low back, and she's coming in with some chronic low back pain. I'm going to show her how to decrease the stiffness and do something for herself at home. She can use the floor at home if she can get down and up off the floor. She can use a table or a massage table if she has that at home, or her own bed. It depends on the greater the intensity, the flatter the surface and harder the surface, of course, the greater the intensity of the technique. So we're using the table bolster today to kind of get her used, or the table to kind of get her used to the acupressure and the fulcrum of the pillow that the pillow offers. This is a heated small flax pillow. It doesn't look like very much, but boy, can it do a lot. This is our favorite pillow for people who live with chronic low back pain. You place it not in the lumbar region, but against the sacrum, and then lean back against it. But on the table, I'm going to have Lisa raise her knees all the way up, and I'm going to have her roll over towards the camera, and I'm going to slide this underneath her hips. And I'm going to use my thumb along her waistline to gauge the correct position. So if you want to roll over towards me, Lisa, and they can see kind of where that is. It's not against the lumbar, it's below the L5. So it should be right against her sacrum and SI joint. Does it feel even to you? Sometimes if the flax moves just a little bit. So move it until you find that sweet spot. Is that good?
Yeah.
Okay. And you've noticed that I've also put a small bolster underneath the cervical spine to keep that supported so that there's no engagement of her cervical spine. The first thing I'm going to do is just really slowly rock side to side. Oftentimes you're going to find your clients have so much tension or trepidation or anxiety about movement that you want to go very, very slow. Other times you're going to find that they're so limber that this is like nothing to them. So gauge it according to your own client or to your own personal issues. The next thing I'm going to do is drop the knees a little bit more and reach over and very gently just hold her shoulder. So this increases a nice lateral stretch. And do the same thing to the other side. The next stage is asking the client to stretch their arms like eagles wings, and take a nice deep breath. And take another stretch. And then I lift the knees. I want to do the lifting, so I ask the client not to help me, or I will have to charge more for their session. So this time I'm going to ask the client to move their chin to the same side that my hand is on. So now we have a real increased stretch. We're going to bring the knee up and just stay relaxed and just drop the knee over and just let it rest over your opposite thigh. And you feel that nice stretch here? It's a nice fascia stretch. But also, it's not just about this side that you're seeing. It's about the other side, her other hip that's right on the edge of that flax. It's moved all the flax over to the edge and created a nice little fulcrum that's creating a counter pressure right into her gluteus medius, right along her edge of her SI joint and the piriformis. Let's do the other side. First stretch, and then bring your thigh up and just let your leg drop. There we go. Wonderful. And back we go. Okay, so if you could keep this leg up here, Lisa, and I'm going to take over on your other leg, but you're going to have to relax, or I will have to charge you more. So what I've done is support her leg very gently because I want to rotate it, put her into a medial rotation with further extension. And very slowly and gently increase the external rotation until bring her foot up to where she can reach it with her left hand. If you could take your left hand and hold on to the outer aspect of your foot And take your right hand and press against your knee. So this time I want you to take a nice slow deep breath. And as you exhale, pull in your hand and push on your knee. Pull in your foot and push on your knee. And hold. Okay, relax. Take another slow deep breath. This time I'm going to walk around the table. And do that again. Pull in your hand, push on your knee. And then rest your ankle on your thigh. Take another nice deep breath. And exhale. And let me just rock you. And then I do the same to this side of the body. Externally rotate. Bring the foot up. Take your right hand. Hold the outer aspect of your foot. Take a deep breath. Push on your knee. Pull on your foot. And do it again. Take a nice deep breath. And as you exhale, push. Okay. Then rest your ankle on your thigh. Take a nice deep breath. And exhale. And this side to side rotation. And assist your client to landing position. And then I'm going to push both knees towards the chest. Lock my arm underneath their instep, both feet, and rotate. First clockwise. I'm sorry, counterclockwise to me. And then clockwise. Ever widening circles. And this allows you to actually increase range of motion, decrease pain and stiffness and tension in that lumbar and the sacral area, and also the piriformis area. So, how was that, Lisa?
That's good.
Yes. So, join me at Pillosage.com to see some of the list of my classes. This goes in level 2 for self-care. MotherEarthPillows.com is actually the website where you can find this and many other different sizes of pillows with some techniques and some suggestions for use for yourself or for your family members or for your clients. We do offer wholesale information to resell these to your clients. They stay within our scope of practice. We're actually using them as teaching tools. So it's a good way to really bring some products into your practice if you're interested in doing that. So give us a call at 800-344-2072, and I hope to hear from you. Thank you.